So it's good to see so many of you here. Looks like this is a topic that's of great interest to everyone, and I'm really happy that so many people are interested in it. My name is Mugdha Pradhan. I'm a and what I do on an everyday basis is help people with their chronic diseases. Um, Now with me today, we have Dr. Rupa Shah, we have Johan Tingra, we have Yukta Mukhi, and we have Jagannath Chatterjee. So the reason why we decided to do this session is because, like I was saying, in my own newsfeed, I saw this petition that came that said, no vaccines, no school, no vaccines. Basically, it was a lot of parents signing a petition that said that they didn't want their kids to go to school until they all got vaccinated for coronavirus. And that kind of concerned me a lot because as somebody who works with chronic health diseases, I know the impact vaccines have on people's health. And I thought the best way to address that issue was to probably bring about experts in India. Like we have a lot of people in the Western world speaking about vaccines, but we don't really have that many people in India who speak about it from the Indian perspective. And we just thought of coming together, and I'm so happy that we have this amazing panel that's going to make this discussion really fruitful. So how we've designed this is we actually received a lot of questions from people who had registered for the webinar already. So we thought of breaking these questions down and asking different panelists different questions based on their expertise, based on their domain, based on their knowledge, and then take it ahead from there. So the first question that I will address the first question, and each panelist will give a brief intro about them and then provide an answer to that question. So this might go on for a little longer than 1 hour, but I'm sure the discussion is going to be so good that none of you are going to want to leave. Secondly, about audience questions, please keep sending them on the chat here. Somebody from my team, Rutuja from my team, is going to take note of each question and send them to me. So at the end of our session, we will answer each of your questions as much as we can. All right. So moving on, I would like to move on to Dr. Rupa Shah. She is an MBBS doctor. She's trained in Harvard University, and she's been practicing medicine for the last 35 years. Dr. Rupa, before we even move on to vaccines, I just thought it's important that we bring some perspective about what is disease, like what really is disease, and what is the role of an immune system?
So thank you for that question. So I have spent quite a bit of my time, last 35 years, looking at various disease processes, why disease happens, and what is the best solution. So it is my thinking that earlier the model that was followed and we still follow is more like a linear Newtonian kind of a model where you identify, it's kind of a germ theory. You identify a virus or a bacteria, and then you want to find some drug that's going to kill that bacteria. So this is a very linear model, blaming a disease, to a particular pathogen. However, body is not that simple. It's a very complex mechanism. It's not, working in that linear fashion. And there are many factors that come into consideration. So the second approach that I understand to be a lot more beneficial is a holistic approach where you take the person as a whole into consideration: mind, emotions, body, environment. Everything plays part in the disease process. It can't be just a pathogen. And when we look at this second model, in that case, we understand that when 10 people are exposed to a pathogen, maybe 5 get it and 5 don't get it. So it's very important why 5 people don't get the infection and why the other 5 get the infection. Both, are good for us to learn from. Now, why they get it, and you say they got the virus or the bacteria. But why the other 5 did not get it? Why? Then you say, oh, they have a stronger immune system. It's not just the stronger immune system. That's just one part of it. What I call it as soil and seed theory. If you look at the virus as the seeds, and our body as the soil, the seed and soil have to match for a disease to happen. If the seeds are around, but if the soil is not suitable, there's nothing that's going to sprout. It's the same way why some people get the disease and why some people don't get diseases. So finally, we are surrounded by billions of viruses and bacteria. They make up our body. Part of our DNA also has viral information. How can we get away from viruses? We can never. We live with them in harmony. They are part of us. So what we have to do is to make our body, our soil, very healthy, very unsuitable. Pathogens only come when their food is available. Healthy bacteria thrive when their food is available. So the only choice is not to shoot, not to kill, but to make our system very healthy. This is how I perceive health, disease, and the role of immune system, and how our environment also plays a very important role in fighting the diseases.
Beautiful. Thank you. That was really a very enlightening answer. I'd like to ask the next question to Yukta Mukhi. Yukta, as most of you know, was Miss World and Miss India and Miss World. And she brings a really unique perspective to this discussion. She's a parent, she has kids, and she has been a researcher in this field as well. So the question to her is, do childhood illnesses play any role in the development of a child, Yukta?
Hi, Mugdha, and thank you all for being here. Thank you, Dr. Rupa, as well, for the laying out the basis for this discussion. Thank you to all the viewers who've joined us. I think it's very important that we all at least start coming together and having these discussions, which there is absolutely no platform for at the moment. And also thank you to Johan and Jagannath Dada. So I'm really honored to be here, first of all. I think what we have to also look at, apart from what Dr. Rupa has said, yes, there's a soil and seed theory, and also in terms of how has our conditioning been as parents. So firstly, how have I grown up? I'm going to look at life in that way. There's a lot of, when you get pregnant as a woman, there's so much of information, there's so much of overwhelm in terms of internet and articles and people saying things, and a lot of it is fear based. So naturally, when you're a first time parent, and considering that we are now living in nuclear families where we don't have a community system with grandmothers and aunts and elders to guide us and give us various perspectives or say how they've raised their children, or having seen different children being raised, I think that whole fear psychosis really gets to you. It grips you. And we end up looking, as Dr. Rupa said, and I'm sure everyone will also corroborate that, we end up looking at everything in a very dissected manner. So this is where I feel that the root of our whole perception lies. The way that we look at the human body, the way that we look at our lifestyles, the way that we treat food, daily rhythms, the way that we look at identifying what does the pediatrician say, what does the gynecologist say, and then, all of that is playing in. But there's nobody saying things based out of ancient wisdoms, whether it is Ayurveda, whether it is Unani medicine, whether it is homeopathy, any kind. We have to really look at what is my lifestyle, what are my eating habits, and considering that fear and stress are anyways going to lower our immune system. So having said that, I feel as a parent, my journey has taught me, I've consciously chosen to engage in not only deepening my research, but I can surely say that I was the parent who was full of doubts and fears and anxieties about, the child's health. And I took my leap of faith and I said, no, this has to stop. We can't be on allopathy. We can't have a quick fix too. There has to be a way where the child's own immunity is built so well. So yes, we want our children to play in nature. Yes, we want to be able to deal with thoda sa bukhar aaya, thoda sa zukam aaya. We have to stop learning to panic. We immediately go into panic. So let the body fight. Let the parent also understand that a lot of the child's falling sick, or even if they have a major illness, is, so I'm going to come from a very spiritual perspective, and I'm not sure if a lot of people will agree. But there is a karmic imprint in our souls, in our patterns, which is why some people fall sick and some people don't fall sick. And whether we look at it spiritually or we want to only look at scientific sort of speak, I've studied Ayurveda, basic. I cannot claim to be a practitioner or a doctor or an expert in the field. However, my experience and understanding has led me to believe that when we look at a human being in a holistic way, and we understand in Ayurveda, they say something called Prakruti and Vikruti. So, Vikruti is what they term as if you've kept a bucket under a water tap which is leaking, and right next to the bucket is a crater, which is your Vikruti, which means you already have a predisposition from a past life or your genetic makeup, whatever you may want to call it, to that certain kind of illness, which is why some people will veer more towards sweet foods, salty foods, sour foods, and then those foods tend to contribute to your. So, that is a separate part of the discussion where we may say, okay, there is a whole connection between the gut and the psychology, which now Western science is proving it. But really, the root of everything lies in our food and our eating habits. How we eating, what we eating, what kind of food we're eating, which is also very polluted today. So again, coming back to Vikruti and Prakriti, which means a person's basic constitution and their weak sides. So if a parent is able to just understand their own body like that, I think they'll have more confidence in being able to look at a child's illness at a very young age and say, okay, now it seems medical intervention is required. Until this time, I think I could have handled it with home remedies or with letting the child fight it out on their own, letting it pass and understanding how can I support them through this sort of detoxification.
Right. I think
So yeah, very
I,
important to look at childhood illness as a stepping stone to slowly say the child is building their immunity.
absolutely. I think
Babies are building their immunity. We don't need to start pumping them with vaccines and with allopathic medicines just because thoda sa zukam bukhar aa gaya, viral ho gaya, and then we've started the whole pediatrician ka.
absolutely, absolutely. I think what you emphasized on very correctly is the fact that most childhood illnesses actually play a very important role in just creating a stronger human, right? So
Absolutely.
as the immunity builds, you become more resilient to different things that might be coming in from an environment, or it might just be a feedback loop that, hey, stop doing this, it makes my body sick. But brilliantly put. Thank you so much.
Thank you.
Jagannath, coming to you with the next question. Now, I understand you've been doing vaccine research for the last 35 years. I've done like vaccine research for the last, I think it's just 0.0% of the total time you spent in vaccine research. So the question for you, actually, I have three questions. One is, how do vaccines work? Secondly, what is the theory behind vaccination? And third is, can vaccines really eradicate diseases?
Yeah, well, I'd like to put in a little about childhood illnesses, just one sentence.
Okay.
There are several studies to show that children who suffer normal childhood illnesses, they do not develop chronic illnesses or even cancers later in life. And I'll tell you about cancer research. They are now finding out that infecting a person with measles, mumps, rubella, or even the polio virus is helping them recover from cancer. So we must understand that these illnesses are not diseases per se, but a development process of the body. Now I'll come to vaccines. Vaccines are supposed to put a mild antigen, attenuated or live antigen into us, and hoping it will create antibodies to it and therefore protect us from disease. But this antibody theory of immunity was put to rest in the year 1940 by Dr. Merrill Chase. He was an MD. He was researching on the immune system in guinea pigs, and he found out that we have a system called cellular immunity which provides immunity, not humoral antibodies. He said only a natural infection that goes through the whole process within the body can provide immunity. nothing short of it. So technically, vaccines have been proven to be ineffective in the year 1940. And they went through desperately with ignoring these findings. And also, they say they put an antigen into the body. But what they don't say is it is put along with a lot of other ingredients, including biological matter and cells. So can the body distinguish that and in that find that particular antigen and provide us immunity against it? That is a very big question. And you know, the Corvalva study on vaccines did not find these antigens in some vaccines they studied. So this is the state which we face today. This is the condition we face today. And regarding effectiveness, well, we have vaccine failures. They stare at us in the face. If that disease does not develop, they say vaccine has worked. But that disease does develop and they ascribe some other name to it. That is written in their text. You know, a person who is vaccinated against a disease, he cannot develop that disease. So what these doctors do at that time, they give this disease another name. So the vaccine effectiveness is assured. It is a fraud on our system, you know, that they say vaccines are effective. And also, in any disease, suppose you take polio, 95% of the people who are exposed to the polio virus will not develop any symptoms. Rest 4% will develop very mild symptoms like the flu, or a common cold or the flu at best. And of the remaining 1%, they may suffer from certain kind of lameness, and majority of them will recover. So vaccine effectiveness is based on the theory that everybody is affected and therefore vaccines protect a lot of people. That is absolute bullshit. So we should let people know about these controversies, and only when they know the complete picture, let them think about whether they should vaccinate themselves or their children.
I became all, I went on Zoom etiquette and I forgot to unmute myself. So sorry. I was saying, thank you so much for that answer, Jagannath. In fact, one of the things that you spoke of, polio, is actually the next question that I'm going to ask Johan. Now, Johan, how to describe Johan, right? I'm always short of words. But I think citizen scientist is the best way to describe him. And the level of research that he goes into in so many fields is unparalleled. And vaccines is something that he has been researching for very long. So the question to you, Johan, because this is something that a lot of people ask me when I say vaccines, right? And then they're like, but what about polio? So the question for you, Johan, is was polio really eradicated from India? Like, is India really polio free?
Firstly, Mugdha, thanks a lot for the kind introduction. Yeah, you can say citizen scientist, but really I describe myself as a open-minded skeptic, which doesn't take anything at face value and always wants to formulate his own opinions on, what the truth about any given subject is. So, I mean, among all my research, I'm highly passionate about health and nutrition, which is what got me started researching the vaccine rabbit hole. Jagannath ji said, something very important about polio, which I'm going to describe in a little more detail. 74% of all polio cases are asymptomatic. Firstly, polio is like a mild gastrointestinal virus which just passes through your GI tract for most people. After 74%, around somewhere between 15-20% are abortive polio cases, wherein you have like a slight fever, diarrhea, or something like that. And there's an even smaller percentage which is non-paralytic, where you have something called viral meningitis. And then there's like a tiny 1% which is actually paralytic polio. And like Jagannath ji rightly said, most of those cases, recover within 2 years of treatment. And surprisingly, when you actually go through the CDC records and you try to see the statistics on polio, they never state the recovered cases. They only state that someone got it. It's to, perpetuate this myth about polio that, the way most people think about polio is a kid with paralysis in the developing world, or someone on an iron lung machine, which was the precursor of today's ventilator, which we know has a lot of problems, obviously. So that's not what polio is. The main thing I'd like to tell the viewers is polio is not a synonym for paralysis. And there are many, many other reasons like birth defects, things to do with pesticides, which I'll touch into in this segment, and many other things that can, induce polio-like symptoms of paralysis that we're talking about. So this whole deal with polio eradication in India, it stems from this concept of eradicationism, where, the people who are really driving this, that I'll touch into a little later, they came up with this concept that, oh, we fully need to eradicate this specific virus, for it to be a successful campaign, which is not based on anything. I mean, if you really want to eradicate polio, you're doing it because you want to eradicate paralysis. But if, even in theory, if you're going to eradicate polio, but people are still going to get paralysis from many other reasons, including the polio vaccine, which I'll talk about, then, I mean, it's just an eyewash. You're just claiming that something is eradicated, and you're like playing with the definitions. And like Jagannath rightly said, they changed the definition of how they classify polio in the 1950s, from the time the polio vaccine was introduced. Before that, they had a different category of actually diagnosing a polio case. And after that, they changed it, which made it look like the cases went down because of the vaccine. So, I mean, there are many interconnecting things here. But about India specifically, I'd like to say that in 2011, India was declared, I think 11 or 12, India was declared polio free. But this issue got taken up by a certain person who was sitting in the board, which actually makes recommendations to the government about which vaccine should be in the schedule, called Jacob Puliel. So Jacob Puliel actually, he wrote two papers. He's not only him, but they've come in reputed medical journals. This is not online conspiracy talk, where he actually spoke about how, when they dug through the data, firstly, one of the big criticisms he got is that the Indian government spent $2.5 billion on polio eradicationism, which is not something they came up by themselves. It was actually the Gates Foundation and like other NGOs that came in and gave a little boost to influence the policy in that direction. And then they literally put in $2.5 billion to eradicate something which is a mild gastrointestinal virus. So that was the first criticism that he made, that if those $2.5 billion were actually spent on things that we know improve real health, like sanitation, nutrition, and improving people's immune systems and stuff, it would have been really helpful in terms of its impact than claiming that you eradicate a virus, which literally doesn't mean anything. And the second most important thing he said in that paper was that they saw a direct correlation between the doses of oral polio vaccine that they administered to the children. And he said that if a child received more than 6 of those doses, something called non-polio acute paralysis cases went up in proportion. So non-polio acute flaccid paralysis is basically paralysis, but it's twice as deadly as polio. So what he's saying in that paper is that they found a very, very strong association between the number of oral polio doses that they gave and the non-polio acute flaccid paralysis it was causing in the children, which was, as I said, much, much worse than polio. So they're trying to remove the polio virus, they're trying to eradicate the wild virus, but in doing that, the vaccine is actually, I wouldn't say causing, because there's an association which he said needs to be investigated, and we all know correlation isn't causation. So if there are any skeptics in the crowd, I'm making that clear. But we'll come to the topic of our vaccines tested for safety in the first place. Because if you want to claim that a vaccine has eradicated a certain illness, you have to do randomized double-blind placebo-controlled trials. You just can't establish causation where you say, oh, this vaccine eradicated this thing, if you don't have those kind of trials in place. So I would turn that back on the skeptics. The thing about correlation is causation, because when we say that this oral polio vaccine is highly correlated with causing non-polio acute flaccid paralysis in these people, and it needs to be investigated, we need the trials where we actually do give a group of people a placebo, we give a group of people the polio vaccine, and then we see really, what is the end outcome. These kind of trials aren't done, which I'll go into detail a little more later. Yeah, so to basically sum it up, what I'm saying is that their cure was worse than the disease. They tried to eradicate polio, but it landed up causing something much worse. And they conveniently didn't investigate it, even though there was like a highly statistically significant correlation between the number of doses of the vaccine they gave and the amount of paralysis it was causing. So to sum it up, basically, there's a lot of research Okay, this is from CDC data, the numbers that I spouted about the deadliness of polio. And these numbers come from a time when polio was endemic in the 1950s. So we are not talking about now where a few cases of polio are officially left on the books. We're talking about a time in the 1950s when the polio was really considered to be a problem. And in that time itself, most of the people who contracted the polio virus could deal with it just fine. Some would develop mild symptoms, some would develop something like a viral meningitis, and a very, very tiny percentage of those, less than a percent, probably 0.21%, somewhere around that mark, would actually develop paralysis and would not be able to recover from it. Other than that, most of the people, the vast majority would contract it and be fine with it. So we know there is data suggesting that DDT use, arsenic use, different kinds of pesticides, lead, all these things have been shown to cause the same symptoms as polio. And if you were to put the whole picture together, basically polio is a mild virus, but if you have these toxicities, if you are pesticide poison, or if you're living in an area where DDT is still being used, like it's being used in many pockets in India to this day, which is why India has a higher rate of non-polio acute flaccid paralysis, combined with the oral polio vaccine, which played a role in increasing that as well. So again, the thing that so many people alluded to earlier is that it's not all about the virus. The virus is something that can gain hold in your body if you're already in a disease position to begin with. And we see this in the data again, like even in this polio case, if someone is free of lead, arsenic, and DDT and stuff, they would most likely be part of those cases who would recover on their own. It's just these tiny, percentage of people that already are diseased with metal poisoning and pesticides and other factors like electromagnetic fields. And then when the virus comes in contact, it basically, causes a spiral. Yeah. So polio is a mild gastrointestinal virus. That's the perception that needs to change about polio.
All right. Thanks, Johan. All right, so the next question coming back to you, Dr. Rupasha, and in fact, somebody from this audience as well had the same question. Jagannath spoke of, apart from the antigen, there are many things inside a vaccine, right? So if you could just tell us what are the harmful ingredients that are there in vaccines? Because I think as a parent or even somebody who might have to take some sort of a vaccine in the future, I want to really know what is it that one syringe is putting inside my body, because I'm so concerned about everything that's going in, right? So if you could just tell us what kind of ingredients are there really there in vaccines that might not really be so good for anyone's health.
So let me tell you first of all that there are always two sides of a coin. So what we may call as harmful may not be considered harmful by the other half. So I will be only listing out certain ingredients. However, let me tell you that the response always differs from person to person. There's a possibility that out of 100 who are vaccinated, very few who react to the substances that are put inside the vaccine. And therefore, you may want to label as harmful for those particular individual. And there's a possibility that the rest of them had no reaction, no adverse reaction at all. So there are substances that are seen inside the vaccine are formaldehyde, mercury, aluminium, then there is also thimerosal, and also there are some animal ingredients because animals are used, infected cow or pigs or chicken, because the vaccine, that is the part of the vaccine process, and also sometimes MSG is found. So these are just a few things, and there's also a protein enzyme called as nagalase. So this just making simple thing, making it all simple, that these things are used in the process of preparation as a part of, making the vaccine. Some vaccines are now clean up, of mercury. They say now there's no more mercury, but it may be there as thimerosal because that's again a mercury compound. So these things are found in the vaccine, and some individuals are very sensitive, or I would say they're oversensitive, then they react to it, and then more things happen later on.
All right, thanks, Dr. Rupa. And I think that's really because we see some adverse reactions to vaccines, and I think what you're saying makes sense, that the bodies where detoxification pathways might not really be fully functional is where we see the most adverse effects of vaccines. But thank you for that answer. I have personally seen that sometimes you might not, see an immediate impact or like what we call as the harmful impact of a vaccine, but over time, over uh, a period of a few years, a chronic disease might develop that we could ascertain the root cause to have been a certain vaccine incident.
Because the whole thing works like a key and lock mechanism.
Right.
If the key fits into the lock, then the trigger happens.
Hmm.
Otherwise, it just passes off.
All right. All right. Thank you so much. So somebody just now in the audience said that this sounds like a conspiracy theory workshop. Well, it's not a conspiracy theory workshop. It's an attempt to share knowledge that might not be available on mainstream media. And it's important that we know this because it's your health, it's your body. If you don't own your body, who will own it, right? We all know what is being
And
sold as...
he also mentioned that where is DDT being used in India now?
We will come to those questions.
I just want to point out that it is being used in the malaria eradication campaign.
Oh, okay. All right. So yeah, so coming to the next question, which Yukta, I would like to ask you. Like you have done research in terms of why you wouldn't want to vaccinate your kids, right? So what are the risks that one would commonly associate with vaccination?
Mugdha, what is important to also understand is that there is a significant number of parents who've experienced the ill effects, side effects of vaccines compared to those who are not even waking up to what is happening with their child. And I say this that when I was unaware as a parent, when I had not yet educated myself, where I was not questioning the medical profession or whatever was being given to you in terms of ye karna chahiye, this is the next latest thing. Firstly, we've given our power away to the pediatrician, with all due respect. Secondly, we are not looking at the cycles that happened when I used to vaccinate, when I used to listen and have given vaccines to my child. I, as a parent, was so distressed, so harassed, because not only would he fall immediately sick after the vaccine, but then there would be a whole round of antibiotics. So then first he'll fall sick with the vaccine, then he'll be given medicine, then he'll have a reaction to the antibiotics. It was a never ending chain. Now, what really happens in terms of, if we are to understand purely, again, coming back just to the gut, is that when the body doesn't recognize a certain element, because it is not natural to our system, because we are not biologically designed to break it down, because we don't have the biochemicals in our makeup to be able to, for the brain to give that signal or give that command to the digestive organs ki abhi ye aaya hai, isko ye karna hai. What happens is that metal or those very dangerous things which have been put into the vaccine start to pass through straight directly into your bloodstream. So there is a term for it, which I will post and share later on. But what really happens is, because it goes straight into your bloodstream, it has not been eliminated. When it has not been eliminated, it ends up going straight to the brain and having a very bad counter reaction, which is where we see now finally the CDC on some level have not openly declared it, but now they're willing to admit it, that there is a connection between vaccines and autism. And I'm saying autism is just one of the things which we are able to identify today. There are a number of ton of other things which, as Jagannath Dada also said, and you mentioned, that over a period of time, if we did not take that health or the responsibility of me being healthy or my child or my family being healthy into my own hands, I will then have the repercussions of those medicines in the long run. So the fact that there have been enough documentation for the last 150 years, right after in this 18th century when vaccination was first introduced to humanity, the fact that that has been very, very categorically, one can say that has been manipulated and has been very intentionally suppressed from the public, goes to say that the people who are behind this vaccine industry, whether it's the pharma companies, whether it's the people who are printing textbooks that the medical profession is learning, have vested interests behind it. Because if that was not the case, then why do we not have transparency? And first of all, a virus cannot be isolated. So the fact that a vaccine is being based on the fact that it's an antigen does not even arise. several side effects that then start to happen is that your immunity gets lowered, which is what we actually wanted to achieve. We've gone to the other end of the spectrum. We've have had a counter effect of it. And then to combat that, we ultimately will have to rely on ancient wisdoms of Ayurveda and homeopathy and Unani, which are giving practical results. और जैसे हम बोलते थे दादी नानी के घर के नुस्खे for small things. I'm not talking of major illnesses. Again, I'm reiterating, medical science has its place when it comes to an extreme emergency, which means that it has to be a life-saving situation. Now, why have we even reached to a point where we are counting? Like for me, the platform of when we are saying we need a vaccine, the question arises, how did that illness come into our society or in our culture in the first place? So we really have to first go down to digging those facts, whether people are saying about polio eradicate hua, smallpox eradicate hua, measles hai, whatever, this can be life-threatening. How many people do we know who have had these illnesses and have recovered from it? And how much are we able to allow our mind to be opened up and just consider that yes, there can be a spiritual blueprint in place here where this person's or this individual's body needs to expel this out of their system. And again, going back to if somebody doesn't want to believe in reincarnation or there is a soul and we don't want to go into the whole spiritual thing, theek hai, science tak rakhna hai. Ayurveda is a very ancient science. It's started getting documented only 5,000 years ago. You can't challenge something where people have been in harmony with nature, living with nature, using the herbs and methods that were prescribed by the ancient rishis or the munis, or we call them. They even have in Ayurveda documented how they used to do surgery and very complicated surgeries, which I doubt that even medical profession will be able to do it with those basic instruments or just with those basic. Anyway, that's a separate part of the discussion. So just coming back to the side effects of, if parents were just to start linking, I've given a vaccine on this date, my child falls sick within the next 48 hours, 72 hours, whatever it is, these are the symptoms. Then I rush to the pediatrician. They say, हाँ, उसका reaction हो रहा है, ठीक है, ये दवाई दे दो. Then on top of that, when the child is already needing to build their immunity, then I want to pump them with the antibiotics, for which also we don't have any research, because now I'm panicking as a parent. So now whatever the pediatrician tells me, I'm going to go buy that drug. It's a vicious cycle. We really need to break it. We really need to step out of this whole paradigm, and we really, really need to reclaim our health. And I'm saying this from personal experience as a parent, as an educator, as somebody who understands science, and as somebody who wants desperately for all of us to come back to living in harmony with nature. And more so, I want to emphasize on the point of women have the ability to sense what is happening with the child. When you know what's happening with your body, when you're carrying a baby for 9 months, when you're nursing a child, knowing fully well that mother's milk is all that a baby needs in terms of building their immunity. Why do we not trust that intuition when the child starts growing much older? A mother's body, a woman's body is her wisdom. We don't need to constantly confirm and rely on external sources to validate what we already know about our kids. And that is where our power lies. That is where the whole game is going to change. When mothers stand up as warriors of light and say, enough. I decide my family, my body, my child, I'm going to decide what happens with. Not to say again that when an emergency situation arises in specific cases, in certain situations, for certain parent and child, with all due respect to the medical profession, and all my heart is full of compassion and empathy because I have suffered personally. I know the pain that a mother goes through. I can completely understand if a mother gets desperate and says, just fix this problem right now. I need my kid to get better. So when we come to that stage of hospitalization, what have we done before that in terms of food, lifestyle choices, and rhythms of the day? What time is my child sleeping? What time is my child eating? What time is my child waking up? What are the things that I'm feeding them in between meals? Everything plays a part. Everything is a huge factor in terms of contributing to immunity.
Absolutely, Yukta.
Yeah.
So yeah, great. I mean, I love that sentence. Like mothers have to stand up as light warriors and say my child.
Absolutely, absolutely. The
In
sword
fact,
and shield is in my hand.
Yeah.
I don't give that power away to anybody just because they have a pen and सर्टिफिकेशन पे लिखा है डॉक्टर है, ठीक है भैया आप डॉक्टर हैं, बट हमारा इंट्यूशन से बढ़कर कोई डॉक्टर नहीं होता. Somebody said to me, I'm a scientist. I said, my body is the soil of science. I am birthing a soul. It cannot be challenged.
Super.
It cannot be
So-
challenged.
Great. Powerful words. Jagannath, in fact, I just wanted to continue the same question, like when she spoke of the risks associated with vaccines. The question that I have is, would you consider, you've done research on vaccines for the last 35 years, would you consider vaccines safe and effective?
Well, nobody actually says vaccines are safe. Nobody says that except the pediatricians and the vaccine lobbies. The pediatrician says that because they have been told to say that to parents, they're instructed to say that to parents. And everybody knows that if the parents come to know there is some risk with the vaccine, they will not give it to that child. And there are many aspects why vaccines are not safe. As Dr. Shah pointed out, the ingredients. You don't inject ingredients like mercury, aluminum, fetal cells with DNA, animal avian serum, endocrine disruptors, and those things. So if you want to say vaccines are safe, you have to completely abandon the science of biology. You have to abandon the science of toxicity. You have to abandon common sense, and then probably say that vaccines are safe. And the NIH database, we have a collection of 1,339 studies from the NIH database that discuss vaccines linked to 292 diseases, disorders, including death. So, and the vaccine package inserts, they talk of 217 diseases that have been reported after vaccination. And of these diseases, the Institute of Medicine has studied 157. They found that, yes, 150 diseases are indeed linked to vaccines, and they reserved their judgment on the other 7. They did not say that the other 7 did not occur. So, and if you see, as Robert Kennedy always says, if you see the diseases we witness in children today, we find those diseases in the vaccination package inserts. You cannot deny that. And that is a huge scandal. And vaccine safety, does anybody study vaccine safety? In the USA, the government, the industry is supposed to, or the institutions are supposed to submit vaccine safety records every 2 years. They don't do it. They have never done it. So vaccine safety is out of question. Nobody can say vaccines are safe. Regarding effectiveness, I have already said, to be effective, it should protect against any disease. But the fact that antibodies cannot provide immunity itself renders the science that vaccines are effective. It completely rejects that assertion. And we know it for a very long time. And I also told about cellular immunity. What happens to that? And we have vaccine failures. I've already told about that. So nobody can say that vaccines are safe and effective. It continues because of a reason. The medical industry needs diseases to grow and profit from. Therefore, they actually need vaccines to produce those diseases. Vaccines cause inflammation, chronic inflammation. Vaccines cause autoimmune conditions. And all the chronic diseases we see in society today can be classified as autoimmune inflammatory conditions. So vaccines are actually converting these acute diseases into chronic diseases and benefiting the industry. The doctors are benefiting from it. The industry is benefiting from it. The people are losing out. So these issues are never raised. I have raised them in conferences. I have been shut down. So once again, I tell parents, research vaccines. They are neither safe nor are they effective. Their children are being sacrificed because an industry exists that wants to go and profit. Mukta.
Thank you so much, Jagannath. The numbers are mind-boggling, and it's insane that this never comes into mainstream discussions. Johan, the next question for you, because I know you've been following what's going on with COVID-19 and the coronavirus thing, and how everybody's pushing for a quick vaccine for it. Uh, how long does it really take to develop a vaccine, to test and research it before releasing it in the market? And is it really unethical to use a placebo in vaccine trials?
Yeah, Mugdha. If I can just request quickly, Dr. Rupa, can you turn the screen share on? Because I'd like to share 2-3 slides if I can. So basically, what I'd like to say is vaccines have never been proven to be safe or effective. The way they get around this in the trials is they basically they call it a placebo, but what they're giving to another group is a prior vaccine or a placebo which contains aluminum in it. So they'll basically give one group of people a vaccine that they're trying to introduce, say a new vaccine for coronavirus or something like that, and they'll give another group of people a placebo. They'll call it a placebo, but when you actually go into the fine print of the study and try to find what the placebo is, many times you can't find it, and many times it's literally disingenuous because they call a placebo and like a aluminum containing solution, which is really unethical. I mean, it's just lying, in my opinion. So firstly, they don't use placebos, and the World Health Organization guidelines actually call using placebos in vaccines unethical. So they say it's unethical to deprive the control group, which they are using to compare the vaccinated group against, and they say that it's unethical to not give them a safe and effective vaccine. But when you actually go to think about it and see, okay, how did the prior vaccines get approved? They've got approved by the same process. So if you go trace it back like that, 99% of the vaccines on the schedule haven't been actually tested for safety. And you can't claim that it's safe until you actually have a group that's not been given vaccines at all. This doesn't happen. And when they say effective, in the trials, what they're trying to do is they're not seeing if the group of people that they've given the vaccine actually go forward in life and are prevented from getting the infection that they're trying to protect against. They basically see the antibody response, and if the person who's being subjected to the trial has developed a proper antibody response, they claim that the vaccine is effective. Couple of other tricks they use in the trials. They use the healthiest of people possible. I've read many vaccine studies, and they basically have ways to eliminate all the children which don't fit the criteria, and they take the healthiest of children possible. They test it on them, but then they want to impose the vaccine on everyone. They want to impose it on elderly people. They want to impose it on most of the population which haven't been included in those trials to actually see if they would be protected or not. So I mean, those are the two things. And the third thing is, they basically, when they're doing the trials, anyone who drops out of the trials when they're in process, they get excluded from the final data. So say in the first slot, when they're given the first vaccine, if someone has an adverse reaction and drops out, they'll be literally not counted in the data. So many people drop out like that, and till the end, whoever's left, the analysis is done on them. So there are tricks like these that are used in the studies to actually portray and chant this mantra constantly that vaccines are safe and effective. They're safe and effective. But most people don't go and dig into studies. Most people just see headlines or the way the studies are reported in the media, which is something I'd like to show you now. So one sec. So basically, there's a trial of this rotavirus vaccine, which got reported in the media as being unethical, because they. So if you can see, unethical clinical trials still being conducted in developing countries. So this was a rotavirus vaccine trial that was being done in India. It was funded by the Bill and Melinda Gates Foundation and other agencies, as you can see. And the media reporting of the study actually claimed this was unethical because they used the real placebo. So if you see it here, they say that 2/3 of the infants received the vaccine and 1/3 received the saltwater placebo injections. Now let's go to the actual study. So this might come across as, oh, okay, Johan, you're wrong. See, they actually used the real placebo. I've gone through this paper and I've tried to find what the placebo is. And they don't mention what the placebo is. And it's an important question, because if you see many vaccine trials, They call it a placebo, like I said, but they're using aluminum adjuvants. So I want to know what the placebo is. I can't see that. And another highly disingenuous thing is, if you read here, other childhood vaccines combine diphtheria, pertussis, tetanus, type B, hepatitis B, and the oral polio vaccine were given concurrently to both groups. So they're literally giving the control group, which is supposed to, like, reflect what a non-vaccinated person would look like. They're giving them all these other vaccines at the same time. They're not giving them the rotavirus vaccine. They're giving them a placebo instead. We don't even know what the placebo is. It could be an aluminum adjuvant. And they're giving the group that, is part of the main group that they're trying to test the new vaccine on. They're giving them all these vaccines and they're giving them the rotavirus vaccine. So this is actually, like, example, an egregious example of how these trials are done, where they say they've proved to be safe, but if you actually go and read the fine print, it doesn't work out like that. And then there's a talk about the surveillance systems. Okay, like, we have systems in place where if children are damaged or someone is damaged from a vaccine, you can go and report it. So I'd like to show you this again. Like, I'm just showing stuff that's very relevant to India. This is a report from The Wire. And this is what Jacob Pulial says. He's part of the National Technical Advisory Group on Immunization, which actually suggests our health ministry which vaccine should go on the schedule and which shouldn't. So he's not a conspiracy theorist. And he says, if a child is admitted to a hospital with intractable convulsions after vaccination, if it survives, the reaction could be classified as vaccine product related. But if it dies, it will be classified as a coincidental death, underlying or emerging condition, or condition caused by something other than the vaccine, or unclassifiable. So, I mean, they literally said openly that they assume that if someone dies from a vaccine in the surveillance data, they'll always assume that it's something unrelated to the vaccine. And in the trial, where we actually, would get an idea if, the group that they're testing it on is developing these things, has all the problems I mentioned earlier. So we literally can't determine if vaccines are safe and effective. And I mean, it's just disingenuous outright that the World Health Organization and the guidelines say that placebo use is considered unethical. Now, I'll just quickly touch on the other thing you spoke about as to how long these vaccine trials take. They usually take anywhere between 5 to 10 years to develop. Some vaccines have been developed faster. I think like measles was developed in 5 years. I'm not like, don't hold me on that. But most vaccines take somewhere around that time. So the COVID vaccine they're trying to rush right now, I'll elaborate on this in much more detail in the coming questions. But they're using this new kind of technology called mRNA and DNA vaccines. So this is something Gates has been promoting since way before this pandemic started, saying that, in the event of a new pandemic, we need to be ready. We need to have vaccines which can be prepared fast and which can be distributed fast. So he's put a lot of money going back to 2016 through something called CEPI and other things that he's been funding on these RNA DNA vaccines, which can be manufactured highly quickly. And we go into the problems associated with that later. But yes, this is a big problem because the COVID vaccine that's going to be coming out right now isn't going through any of the robust safety testing that I would like to see to actually determine for myself that, okay, it's safe and effective and I'd probably want to take it. But that's not being done. That doesn't happen for any of the previous vaccines. And to add to that, these people have basically like shortened the timeline to a year or two, and Gates wants immunity. So he's openly out in the world saying that he acknowledges that, there can be risk of adverse events. If 1 in 10,000 people die from being given this vaccine, if 7 billion people are given this vaccine, like he's saying, so 700,000 people die, and he wants immunity from that. So, I mean, I have no idea why anyone would want to take a vaccine. They're rushing it. We don't even know what's inside it already. And people are already like, going crazy. Like Mugdha, you were speaking in the beginning about those parents who signed that petition to want a vaccine to send their children. Just given all of these facts, I think it's outrageous that any parent would want to do that to their child. Yep.
Thanks, Johan. That was really interesting to know. Dr. Rupa, the next question for you, since Johan started speaking about the COVID-19 vaccine, is a vaccine really a cure? Is there like the vaccine which is going to cure coronavirus, which is what a lot of the people are waiting for? Is there something like that? Is there going to be the vaccine that's going to cure coronavirus?
Mugdha, it is very tricky, very, very tricky, because virus is mutating all the time. And virus is behaving differently in different people. no two human beings are alike. And to try even attempt to find a vaccine for this virus is not going to be that fast. It will not even be, also the immunity doesn't last, because the person who is infected with COVID, even after a few months again can get infected. So even that is happening naturally. I doubt how a vaccine will hold out. If you give a vaccine and it's going to suppose work only for a few months, it's just not worth it. Plus the CDC data, Center for Disease Control data, is saying that the mortality rate for this is only 0.26. If it is that low mortality, why would you want to vaccinate the entire population and give all your efforts into that direction, when we have such bigger diseases like tuberculosis and all the other lifestyle related diseases like diabetes, hypertension, that needs more money and attention. Another thing is that it is observed that COVID-19 is attacking more people with those who have obesity, diabetes, comorbidities of this kind, and immunosuppressive conditions. Now we have a reasonably decent idea about who are getting it and who are succumbing to it completely. So if we can identify them and focus on strengthening their immune system, that is a much cheaper and easier alternative than to kind of look at the rest of the population that's not getting it, trying to vaccinate them or trying to get them pharmaceutical dependent. So I call it as vaccine dependent. We are moving towards a world which is unfortunately becoming vaccine dependent. We don't need to, we do not have to. There's a very simple solution, is to just become immune, strong and healthy, and do not become that soil that allows these pathogens to thrive in. And the most important thing, we are not separate. Our body is not separate from our environment. We are not living in an isolated environment. It's not a linear environment. Whatever happens to our environment, some of it's going to get into our own body, and it will create the same environment, and it's going to let this kind of viruses take birth from time to time. Last 25 years history, we have seen these epidemics happening again and again and again, and it more are lined up because of so many mistakes that we are making for our health and for our environment. Why not correct that instead of just focusing on a product like vaccine? Just look for the cause where these viruses are taking birth and coming into our body, coming into a pandemic, and eradicate the cause there itself so that the new such epidemics don't happen.
Beautiful. I think that's what all of us need to focus on. And the only thing I think is it's a lot of it takes more commitment and discipline to really focus on your own health and clear away all the terrible lifestyle patterns that you might have that might be creating a disease. And it's easier to say, oh, poke me with that injection on my left bum. I'm going to be free of coronavirus. Right? So I think that's why a lot of people are waiting for the vaccine. But thank you, Dr. Rupa. Jagannath, so what Dr. Rupa touched on was the fact that viruses mutate, right? And that's something that I want to ask. So there have been prior attempts by scientists to develop vaccines against different coronaviruses. What really happened when they were trying to develop vaccines against different corona? Because COVID-19 is not the only coronavirus that we know of. There are other ones as well. So what happened when they were trying to develop these vaccines?
Actually, the coronavirus is about the common cold. But in the year 2007, we had the first SARS attack, SARS. And since then, they tried, having vaccines against them. And they faced numerous problems. And I can list out the problems they faced: molecular mimicry, bystander activation, viral persistence, epitope spread and sharing, antibody-dependent enhancement. These 5 things are about autoimmune disorders. Next, they had Th2 cytokine response. The vaccine actually made the disease worse. Then they had innate immunity barrier, CD4/CD8 block, adaptive immunity. This is about, this is vaccine failure. The vaccine failed to act. Then we have strain shifting. When we attack the coronavirus, some other virus is taking up the job. So faced with these things were faced in the animal trials. So what they have done this time is that they have totally done away with animal trials because they know these problems are going to come up. And they are proposing mRNA and DNA vaccines. Now, these vaccines have never been tried on the human population. This is the first time they are going to do it, and they are excited simply because they have a chance to go ahead with these vaccines now. Now, what are the problems with these vaccines? Well, in every place you will find that they have apprehensions that they will change the DNA of the person. So, this is something very huge. And besides these, they cause the same things, autoimmune conditions, they cause chronic inflammation. So the usual problems with vaccines persist despite their saying that these are safer. And these are based upon the ring of the virus. They are trying to get a portion of that ring into every cell of our body. Yeah. So this depends on the ring of the virus, and they want to put it into every cell so that the body becomes a vaccine manufacturing unit. Now, can you believe this? They're going to make our body a vaccine manufacturing unit. This has been stated by none other than Bill Gates. Now, can you tell us what will happen if our body becomes a vaccine manufacturing unit? Nobody can say. So they're pushing us into a region of unpredictability. And the ring of this virus has mutated, and it has happened in India. I've read it has happened in India. So there is no basis for these vaccines to come out. So what I comprehend is coronavirus is just an excuse. They are going to do something. They're going to come up with some vaccines having some properties, which they are going to put into every human being on this planet. Now, this is something, you call it a conspiracy theory. It is a conspiracy, and it is a real conspiracy that they're trying on us. Mogda.
Thanks, Jagannath. Yukta, so we've spoken of vaccine adverse effects. We've spoken of vaccine risks, right? Now you've spent time as a parent researching this, and I just wanted to know that at least in the US, I know there are some methods to kind of claim something, right, in terms of things going wrong. But in India, do you have any way to receive compensation for vaccine damage? Like, who takes responsibility for it? Let's say someone's child received a vaccine and they went through adverse effects. Whom do you go to then to claim compensation for it? Whom can you sue? Who takes responsibility for it?
I think I'd like to sort of start from the other end and saying that first, I mean, unless I don't take responsibility, I really can't place the blame on. So the fact that inside the vaccine box, there's a leaflet which clearly outlines what are the ingredients that have been put, which are so harmful and toxic. Very clearly, it has been labeled what are the side effects that are likely to happen or have occurred, have very clearly mentioned. But no doctor or no pediatrician will take that responsibility to inform the parent. देखो ये सब लिखा है, you take your decision. But what happens in the doctor's clinic is that you go with your baby and they say, 6 महीने का vaccine बाकी है, नहीं लगाया, let me give it right now. You've actually just gone to show your baby for a basic checkup and development that, how tall and how long. Our grandmothers and our ancestors didn't do all this. We've all come through those generations. They survived fine here. One can say, oh, they had so many epidemics. They had so many. Yeah, but they had different lifestyles and they had different issues to deal with. And we have been, our food system and our water and our air and everything has been completely polluted. Our issues are completely different. We cannot look at a quick fix. So basically, Like, I'm coming back to what you're saying, but the fact is, are we questioning as a parent? When the doctor is recommending or suggesting because a pharma company or a drug company is behind it, or some government guidelines have to be followed, this is the whole vaccine schedule, 2 months pe ye dena hai, birth pe ye dena, 18 months pe ye dena. Who decides? Why do I have to believe you? And why are you not allowing me to make an informed decision by showing me what is written inside the vaccination slip of that information of the leaflet? Or telling me this is the latest research, this is how it used to be 50 years ago, these diseases are no longer prevalent, this is how you can come. I mean, let us all have a very open and healthy and transparent discussion about these things. Having said that, I personally am not aware if there have been any compensations in the courts. I have dealt with the legal system in my own personal experience. I personally don't think that India is going to compensate to the level of millions of dollars which happens in the West, which we hear of. I don't think the media is going to report about it. I think half of the media is bought and sold out. All their souls are gone to the devil. I'm sorry to use this language, but they're clearly not going to report about these cases. They're not going to fight with you. Nobody's going to stand with you. You're going to be the lone warrior standing there sounding like a complete idiot. Because even the fact that the judge who's sitting there may also not have a complete information on it, and it's constantly being researched. So we do need to have, this brings what is important is that we do need to have at least a PIL in place, which says that until proven innocent, everybody's guilty. Until proven innocent, the vaccine industry is guilty, the pharma companies are guilty, and I come from a family of doctors. My cousins are going to hate me for saying this, but all doctors are equally responsible. If you're not giving me the information, especially a new parent or a parent from a lower social economic class who goes to work 9 to 5 a day, has to come back, has to take care of the family, I don't think they'll have as much time to be able to do that level of research, which some of us can afford to. So, and again, depending on their level of fear, depending on their level of perceptions, what their social conditioning is. If 20 people in their family are going to say, and psychotically sort of get them into a panic mode, tiger abhi aaya nahi hai, but tiger is screaming at everybody's door, and we are all going into fight, flight, or freeze response. And when your limbic brain has kicked into action, your prefrontal cortex, which is your thinking mind, cannot discriminate and have a logical decision on whether I should vaccinate or non-vaccinate. To me, in the first place, the question is only redundant, because the fact that the kind of nonsense that is being put into a vaccine itself, a common sense, like if I mentioned it earlier also in this chat, my 10-year-old son said if there is mercury and lead, that means it's enough to kill a person. That's just 10-year-old common sense. And he's not even started studying science, because at the moment we are going slow in our picking up on major subjects. So at the moment we've kept ourselves very away from the so-called literature, because again, we don't know the so-called literature. I'm even questioning what I've studied in school. I'm questioning the science that I've studied in college. I'm questioning everything. Who wrote these books? Who funded these universities? And why do I need to believe you when my country has Ayurveda, which has given me the ancient wisdom, which cannot be challenged? It is based on nature and it is scientific. Nobody can say ki, oh, this is all purane zamane ki baatein, or this is all, it doesn't work today and I need to go to office and my child has to go. No, it is scientific. Study it, understand it, have a complete perspective on it, and then we sit across the table and have a very healthy debate about it. But just by taking a stand and saying, nahi, science hai aur mera doctor bola aur ye sab kiya, boss, I'm sorry. That itself is giving me a sign of your intelligence. And that itself is giving me a sign of the fact that you've been clearly brainwashed. And that is giving me I know, Mugdha.
So, Yukta, I actually want to then check in with Johan about this, because he very clearly mentioned, like, especially with the coronavirus vaccine, right? Like Bill Gates is asking for complete immunity.
Absolutely.
So I want to check with him if he knows if there are any ways to receive compensation in India for vaccine damage, or if there is anyone who even takes responsibility for it.
There is actually, Mugdha, there is actually only one case where a consumer court had awarded a compensation for a child who was paralyzed due to the oral polio vaccine.
Okay.
But that court has given several reminders, and it is going on for more than a decade, Not a single pie has been paid because it's a dangerous precedent. That is what they say. It would set a dangerous precedent if
Wow.
compensation is awarded. They have not paid a single pie till now. And as very well, thousands of children die. Our RTI reveals that, and they say 6 lakh, more than 6 lakh adverse effects occur every year. So, and they are murdering our children, they're crippling our children, and our people are silently watching and clapping, and they say the system is scientific, this is about science. This is not about science. This is about commerce, and they are killing for the sake of their commissions, they're killing for the sake of money.
It's insane. It's absolutely insane. All right, then, Johan, I'm moving on to the next question. I think Jagannath answered that question that I had about compensation. So the question is, and this is like a really important one for me also to understand, what role does Bill Gates and what role does the Rockefeller Foundation have? What roles have they played in steering vaccine research development and use in India? And again, people might call this a conspiracy theory, but there is a direct link. So, what is the connection between vaccines and population control?
I'll come to that, but first I'll just add a little bit about the last question
Sure.
that has been missed in this conversation. So even in America, the people who are going to the VAERS reporting system, the court where these claims are paid out against vaccine injured people, the pharmaceutical companies aren't paying for that. The taxpayers basically, when they buy the vaccine, they give a small portion of that money into this fund, and then from the fund that the taxpayers are funding, the money basically comes out in the courts. And I think Jagannath ji said this earlier, but it's important to stress that there have been many sort of analysis and papers done on this. The cases that go in the VAERS reporting system are 1% of all the injuries that take place. Okay, so I mean, and this is admit like the Harvard papers and other kinds of things that talk about this, that the real burden of people who are injured is much greater, and most people don't even know that there's this system, or they don't even know that vaccines can cause these things because of this propaganda about them being so safe and effective. Now I'll come to the very important, I would say, dark component, which is really important to understand today, because even I've been listening to vaccine experts who sort of take the skeptical view, like Dr. Sherry Tenpenny and Judy and Robert Kennedy Jr., many other people. They've kind of kept away from this subject because talking about vaccines anyway gets you the label of being a conspiracy theorist. So if you're going to mix the topics of eugenics and transhumanism into that, that most people aren't going to listen. But we aren't living in times like that. The urgency of the situation is very important, and we need to understand the mindset of the people and the philosophy which drives them, which is behind the push for mandatory vaccines we're seeing today. So if I can share my screen again, I'll show you a bunch of things that are relevant to this discussion. So eugenics, basically, if you want to understand this, it was an ideology that originated in the 19th century, wherein Galton, basically, who was like related to Charles Darwin, who basically wrote The Origin of Species about evolution and things like that. He came up with this branch of study called eugenics, wherein they basically believed that people who are, say, low IQ or likely to be criminals or inferior in some way, feeble-minded, they use all these kinds of terms to classify like inferior people, people of color, things like that. They were like the theory is they were like that because of the genes, because of like what they inherited from their predecessors. And the rich and the powerful, like the Rockefellers and the Carnegies and the Fords and all these other elite sort of bankers, they were like that because of the genetics. So eugenics was literally a field that came up wherein they wanted to exterminate the inferior sections, what they deemed inferior in the population, and they wanted to engineer this kind of race with superior characteristics. I don't want to like go really deep into this, but I'll give you some important points that can help you relate the mindset of these people. From 1907 onwards, okay, America had forced sterilization laws, wherein the government could literally come and record people on the histories of the heredities, like what kind of ancestry they have and what traits they possess. Are they low IQ? Are they more likely to be criminals? Do they have some mental illness? Those kinds of things. And then the state could come in based on the discretion of the medical system, and in some cases the the people on the ground who were going and doing these things, based on their opinion of what someone was, they could literally forcefully sterilize them and stop them from having children. So believe it or not, this was actually legal in America from 1907 up until 1974. Okay, I'm talking 1974. That's like two, 3 decades ago, where in California's last sterilization laws were repealed. And it's important to understand this was going on in a place like America, wherein people could just be picked up and forcefully sterilized. But the Rockefellers are actually the money that funded the eugenics program in Germany, wherein Hitler went on to forcefully sterilize all these people and eventually kill them, because they were considered to be this inferior race of Jews, or other kinds of mentally ill people who were exterminated. And in the Nuremberg trials, Hitler actually cited the laws in America as some kind of defense. Most people don't know any of this stuff. Okay, they think that America is the land of the free, home of the brave, but this is the kind of situation that was present in America up until World War II. After World War II, eugenics basically became this very tainted word, and it was illegal to forcefully sterilize people. So the whole branch of eugenics basically morphed into population control, family planning, these kinds of things. And the same people like the Rockefeller Foundation and other related agencies, USAID, UN bodies, all these same networks basically came to India and continued the eugenic policies under the name of family planning and population control and things like that. Now, why I give you this background is basically to understand the mindset of the people who are driving this today in India as well. I'll come to that a little later. But along with the Rockefeller Foundation, it's important to understand that Bill Gates' father was actually on the board of Planned Parenthood. And Planned Parenthood is an organization that basically promotes family planning and abortions. But if you listen to the founder of Planned Parenthood, Margaret Sanger, okay, she basically said that family planning was like a very important component to eugenics. That without family planning, eugenics was not really worth the cost. So, and she basically promoted abortions and things like that. And she wrote many papers about eugenics, and she was an avowed eugenicist herself. So a former eugenics organization, Bill Gates' father, sits on that. The Rockefeller family literally bankrolls the whole eugenics movement, which saw the massacres that happened in America as well as in Germany. Now these same foundations come along around 1985, and they really start the pick up in the vaccine schedule. So if you can see from my screen here, this is from the Rockefeller Foundation's website, and they openly admit that campaigns to vaccinate all of the world's children against fatal childhood diseases have been an ongoing initiative of the Rockefeller Foundation since 1985. And if you basically read this, it talks about how the Rockefellers really spearheaded the global movement to vaccinate all the children in the world by funding various programs at the World Health Organization. They funded another initiative like 5, 6 years later after that. And then basically Gates comes and picks up the tab and continues the work. So the Bill and Melinda Gates Foundation was mainly created to vaccinate the entire world. And this is from the horse's mouth, I'm not making this up. Bill Gates actually funded $10 billion in 2010 for this to be the decade of vaccines. And after the Rockefeller Foundation started it, Gates literally comes in and starts all these organizations like Gavi and other bodies that have formed till then, which are like collusions between government, industry, and the non-profits. They're not even non-profits actually. That's another area that don't have time to talk about right now. But it's kind of this network where they all cooperate and push their agenda on the people while portraying it to be some kind of partnership between governments and these agencies. So the implications of this are very serious. The same families and organizations that wanted to forcefully kill the inferior races, and most of those were considered to be of the developing world and people of color and things like that, which India still is, they basically got, since eugenics was, they couldn't continue under the term of eugenics, they basically transformed that and continued the same work after 1950, and basically proceeded to sterilize people. So another important component to this is the Rockefeller Foundation, through its Population Council, actually funded this doctor in India called Dr. Talwar. And Dr. Talwar was working on a fertility regulating vaccine that was meant to sterilize women. So this started in the 1980s. Like the first paper came out in 1988, where they actually said that clinical trials were largely successful. They really weren't, if you look at the evidence later on. But the Rockefeller Foundation actually funded this scientist in India who's working at the National Institute of Immunology, and they created this vaccine which is basically like a tetanus vaccine with this compound called HCG. So the theory was that they would inject this into women with tetanus and the HCG hormone, which is a hormone which is involved in pregnancy, and then the body would basically develop antibodies to this compound, which is something which is critically involved in pregnancy. So if you basically vaccinated a woman when she was pregnant with this vaccine, she would abort the child instantly. And if you're giving it preventatively, then it would prevent the lady from having a child. Why this is relevant is this is not just something they developed and left off. There's a very prominent case in Kenya, which I will just summarize over here because I know we don't have time, but it's important for people to understand this, the timeline that I'm laying out here. They use this tetanus vaccine laced with HCG covertly on the people in Kenya. The World Health Organization, along with the Bill and Melinda Gates Foundation and the Kenyan government, basically colluded to give the vaccines in a very like highly suspect way. They basically like kept all of these vaccines with the police. Okay, they were guarded by the police, dispatched from a central location, and they were only given to women. Okay, so you find all these hints if you know how to, like, if you're thinking from a prospect of like a criminal, how would you
Johan,
basically.
it was also given in India, and one NGO had filed a case, but that case was not followed up.
All right, okay, so if I can just finish the Kenyan bit. So basically all these bodies forced this tetanus vaccine on the people. They were being told they were being given a tetanus vaccine. They didn't know they were getting this vaccine that would make them infertile basically. And a Kenyan doctor, actually like a Catholic organization, went suspect because the people over there started to have these issues relating to fertility and stuff. So they got these vaccines tested somehow, even though it was very difficult to get them, and they found it laced with the HCG compound. And this was manufactured by the Serum Institute in India, which is again funded by Gates to a large extent. Like they've given 3 grants. Like if you see the official website as well, the Gates Foundation has been working with the Serum Institute in India, with the Poonawallas, and they've given 3 grants to actually fund the vaccines that are developed here. So you can see this like interconnecting network behind the scenes as to how they all colluded and literally used this vaccine to literally depopulate the people in Africa and Kenya, and they were not told. And when this was exposed in a scientific paper, they basically like really disingenuously covered it up and said that, oh, the HCG amount is too small to cause any kind of infertility. But that's not how the vaccine works. The vaccine gives the HCG, so your body develops an antibody, and then it basically like stops the hormone from working in your body. So if you get the timeline right, these eugenicists, Rockefeller Foundation develops this fertility vaccine. There's a task force, which I didn't mention. There's a task force going back to the 70s of the World Health Organization with the Rockefeller Foundation and other UNDP and other bodies that was created to literally be a task force for fertility vaccines. Okay, so they are all coordinating. They pushed this vaccine on the Kenyan women without telling them, which is criminal. They literally made them infertile. And the main point about India is now, finally, in 2018, we have this report of Dr. Talwar's dreams finally coming true. And this fertility sort of, what do you want to call it, eugenics vaccine, depopulation vaccine to control people's ability to have children, it's going to go through clinical trials. I'm not aware about the status because I followed this until 2018. That's the last report I can find. But as of then, this was going in clinical trials in India. And Dr. Jacob Puliel, who's been like sounding the alarm, mainstream guy, believes in vaccines, but still, kind of ethical for him to express concern about these things. He basically said that the ICMR is promoting this trial. So what he said is the ICMR has been involved in other cases like this, which are highly suspect, like the HPV vaccine, which was being tested in 2009 in Andhra Pradesh and Gujarat. And one committee in our parliament literally accused the ICMR of colluding with the Bill and Melinda Gates Foundation and the NGO that was doing it in order to get the HPV vaccine in the Indian schedule. So this is the same ICMR right now that's promoting these trials about this fertility regulating vaccine in India. And it's not improbable to think that they're pushing for these mandatory vaccines. So what if they mandate this fertility regulating vaccines?
Wow.
Because we all know like how these people think. They think the planet is overpopulated. This is the same reason they're pushing GMOs, they're pushing climate change, they're pushing the transgender movement, they're pushing women's education, which I'm not against, but I'm just like trying to explain the context behind why they push these things is because they want to drastically reduce the world's population. And if people think that the world is gonna get destroyed because we're emitting too much CO2, if they buy into transgender ideologies, which stops them from having children, if women get educated, we have data which shows that they get focused on developing a career and stuff, and they don't have as many children as they would have. I'm just explaining why it happens. I'm not against educating women or something. I'm just showing them the mindset behind why they push these things. So it's not improbable to think, as I said, that they would use something like this in the future in order to forcefully sterilize all of us. And if they've lied before, why wouldn't they do it again?
All right, thanks. That was quite an explanation. And I can't even imagine somebody deciding for me whether I should have kids or not, right? Like, who the hell gave somebody else rights to decide that? But thanks. That was like quite a bit of information. I think what we'll do now, we still have questions that we would want to run through. So we'll just quickly go through those, and then we'll do a separate session for Q&A because there are so many questions that have come. There's no way we can answer those in this session. Uh, Jagannath, Johan already spoke about the HPV vaccine. I just wanted to ask you about, there have been a lot of vaccine scandals in India, the PATH HPV trial, the Gardasil 9 trial, polio eradication. We've spoken of polio anyway, the rotavirus data that was suppressed. Do you have any additional insights to give about these vaccine scandals that have happened in India and where the data has been suppressed?
Yes, the first vaccine scandal was the smallpox vaccination.
Oh.
You see, this vaccine by Jenner, who is not a doctor, it raised a storm all over the world because the mainstream doctors knew that these procedures, they do not prevent disease and that they make the disease worse. So when this vaccine was introduced in India, we saw syphilis, we saw leprosy, we saw tuberculosis, we saw schizophrenia, we saw insanity, and a host of other diseases, spreading across populations. And our doctors and even British doctors, they informed Gandhiji, Rajgopalachari and all that this was due to the smallpox vaccine. And Gandhiji lambasted the vaccine, He said that I am anti-vaccine and the whole world should become anti-vaccine. So that was the first scandal. And the other scandal about this was nobody knew how this vaccine, if at all, led to the eradication of smallpox because when they examined the vaccine batches, they did not find any virus in it. They did not find the smallpox virus. They did not find the cowpox virus. They did not find the horsepox virus. So what they did was they invented some fictitious name called vaccinia virus, which I don't know what is that virus. Nobody knows what is that virus. So there was a huge scandal. Next, the DPT vaccine, we used to read about, romantic stories about spastic children. So when these spastic children, they became normal in society, it led to the discovery that the DPT vaccine was causing it. So they changed the DPT to DAPT, but still it causes encephalitis. Next was the introduction of the hepatitis B vaccine. It is for a sexually transmitted disease. And Indian doctors pointed out that infants at birth do not indulge in sex. So they said, this is crazy. What are you doing? And that vaccine contains mercury. So that was another scandal. Then the introduction of the oral polio vaccine was really opposed in India. Our mainstream doctors, Dr. Pushpa Bhargava, one of our topmost scientists, they opposed it tooth and nail because it was associated with paralysis, it was associated with cancer, and Dr. Pushpa Bhargava also said he suspected it was behind the cases of encephalitis in children that rocketed at that time. Then we have the HIV vaccine. It is a pneumonia vaccine, and Indian doctors said that HIV causing pneumonia in India is that incidence is very small, and you don't introduce a vaccine for a disease which very few people in a corner of the country suffer from, but they did it anyway. Then, of course, the clinical trial of the HPV vaccine, they gave it to 13,000 girls, 7 to 9 died. They did not give them informed consent. So many girls suffered from adverse effects, and the case is still pending in Supreme Court. Then we have the introduction of the pentavalent vaccine. Now, this pentavalent vaccine caused deaths wherever it was introduced. And it started causing deaths in India also. It is still causing deaths. Then we have the, this tetanus vaccine, which was given to girls and women in India. And there was a case against it. Then the rotavirus vaccine, it caused interception. We know about the trial where it reflected a lot of children suffered interception. We filed an RTI, they did not give the data. And the government says, if we release clinical trial data, it will alarm the public. That was the excuse they used. It will alarm the public, so we do not release it. Then they closed down the vaccine public sector units. At least those public sector units could have been accountable to us, but they closed it down. WHO said they are not manufacturing good quality vaccines. They closed it down. They encouraged the private players over which the WHO has more control. Then we have the Delhi MMR vaccine campaign. The MMR vaccine by that time had caused a lot of problems. It was a school-based campaign. And in Delhi, the parents filed a case against it. And the court said, you have to advertise the adverse effects of this vaccine. Then the government said, if we advertise adverse effects, not a single parent will vaccinate. That was the government admission. And then also, we filed an RTI. They said they admitted to 10,612 deaths after vaccination and more than 6 lakh vaccine adverse effects every year. And they said it is coincidence. So you see, they are using the WHO classification system, which allows them to say that these deaths are coincidence. So vaccination is synonymous with scandals. You cannot separate the two. Mukta.
Wow. So, there are more scandals here than all of Bollywood, I think. All right. I think we just have time for one more question. I just want to ask Dr. Rupa Shah this from a doctor's perspective.
Hey,
What really happens?
Sorry, Mukta, I'm sorry to interrupt, but see, there are people who are sort of commenting that, essentially that what we are saying or what you guys are saying more correctly are not correct because it's not coming from doctors. And more like, in fact, somebody just mentioned that this is our outlying findings to conclude something important. So I really don't know what they mean. But
it's okay. We don't. Even I don't really want to spend too much time on that. This is a knowledge sharing session. Those that find useful information here will take back that knowledge with them. I just there is a doctor on board and I just want to ask her this.
If we were doctors and we were earning crores from vaccines, we would not be talking about adverse effects. So essentially, doctors suffer from conflict of interest. They gain from vaccines. They are nobody to talk about vaccines.
Yep.
And they do have markups. They do have heavy markups, the doctors, for giving the vaccines to the children.
Very heavy markups. As a parent, I know how much I was pushed into vaccinating my daughter with so many vaccines that I didn't I don't even want to go there. I just want to ask this one last question to Dr. Rupa Shah. As a doctor, what happens to the body if it is unvaccinated? If there are no vaccines given, what happens to a human body?
So, Mukta, just I never realized that we have actually opened a Pandora's box today.
Yes.
And there's so much of interest in this. I just had no idea, that this is what is going to happen. What I would like to say is that with the kind of pandemic and the situation that we have all, got into at this time, we have to rethink what is health, what is disease, what is a virus, what is a vaccine, what is it is to be pharmaceutical dependent on medication. We have to completely, fundamentally change our thinking. We are living in a very different time now. Last few months, the whole world is struggling. We are on our knees now. And we haven't found a vaccine. We haven't found a medication. We don't know exact protocol. We don't know what is exactly happening to disease. So this is the mess that we have reached. We have to completely change our thinking radically. That's number one. Number two, if someone is not vaccinated, I do not see any reason or any problem with it. I have myself seen quite a few kids who were not vaccinated, and nothing has gone wrong with them. And they are taking natural remedies. Their immunity is stronger. They are not necessarily trouble to anybody else. Because remember, I said right in the beginning, it is the susceptibility of an individual that matters, not the pathogen. And we have to, our entire focus must, shift from virus or pathogen to an individual who is receiving it, who is meeting the virus, who is meeting the pathogen. We have to completely change it, and this is the only way out. Change the focus completely from, shooting a virus or killing a virus or killing a bacteria, to how do we, all become healthy. And in second step, I always said that let us not create an environment where these pathogens, take birth in the first place. They do always come for a reason. I always say every disease comes for a reason. Unless the lesson is not learned from that disease, the disease will not go away. It will remain here continuously teaching us. So therefore, really pay attention.
Thank you so much, Dr. Rupa. And I think we'll conclude the session here. We've shot beyond our time. People came in for 1 hour, and I am so grateful because time is the only currency that we really have now. So I'm really grateful that everyone did stay on right until the end. Thank you for the support. This is information that needs to go out. We together as a country need to take a stand against what's being planned for us. I am not very happy with somebody else deciding what goes into my body and what doesn't. I take great care to take care of my health. And the more of us that unite, the lesser power they have. So this is just about that us coming together. Thank you so much.
And
Right.
lastly,
Thank you, everyone.
if I can just add one thing, I would highly encourage people that vaccines is like one entry into the rabbit hole, but there's a wide area of things that
Yeah.
people need to research and learn about. So, don't stop at vaccines. If you're already open to that and you're questioning it critically, question everything, because
I would,
our
I'd,
survival rests on that, literally.